Hello everyone, I am Sakshi Danapur. Today we will discuss about the types of adverse event. First of all, we see the definition of adverse event. What is the adverse event? Adverse event is any untoward, unwanted medical occurrence that may present during the treatment with a pharmaceutical product, but which does not necessarily have a causal relationship with its treatment. Or in a simple word, adverse event is the untoward or unintended significance occur by the drug administration, but does not causal relationship with the suspected drug. In simply, guys, what is the adverse? The meaning of adverse means the untoward, unintended, possibly causing harm. That is a noxious effect. Then adverse event is any effect or the experience. Then the adverse drug event is the adverse event which happen in a patient taking a drug. Then adverse drug reaction in which the causal causation is suspected between the drug and the event. Adverse drug reaction consists the causal relationship between the suspected drug and the event that can occur. Now we see the classification of a adverse drug reaction or adverse event, guys. So adverse drug reaction and the adverse event are classified on the basis of three parts. So first one is on the basis of adverse reaction are classified on the basis of onset of event. Second one is on the basis of severity, and third one is classified on the basis of Williamson Brown's classification of adverse drug reaction. So, on the basis of onset of event, there are three types of adverse event. First one is a acute adverse event. Second one is a sub acute adverse event. Third one is a latent adverse event. So, acute adverse event consists less than 60 minutes. It is produced within a 60 minute. Then second one is a subacute adverse event. It is produced between the 1 to 24 hours or between within 2 days. The last one is a Latin adverse event produced after 2 days. This is the classification of adverse event on the basis of a event. Second one is a type of reaction on the basis of type of reaction and on the basis of severity. So the adverse event on the basis of severity, there are four types of adverse event. First one is a minor adverse event, second one is a moderate adverse event, third one is a severe adverse event, fourth one is a lethal adverse event. In a minor adverse event, there is little allergy or little reaction can occur in a minor adverse event. In a moderate adverse event, there is a need of hospitalization for a few times. In severe adverse event, there is a need of hospitalization or prolonged hospitalization, or there is a need of lengthy treatment. In lethal adverse event, there is condition of death or life-threatening injuries like death, etc. There are on the basis of severity, there are these four types of adverse event. On the basis of reaction, there are 7 to 8 are adverse events. First one is a type A, that is a augmented. Type B, that is a bizarre. Type C, that is a chemical or chronic. Type 4, that is a type D, that is a delayed reaction. Type 5, that is E, that is a exist reaction. Or type 5, that is a F, familiar reaction. Type 6, that is a G, that is xenotoxicity. Type H, that is a hypersensitivity. Type U, that is a unclassified reaction. So classification on the basis of Williamson and the Browns, the adverse event are classified into 7 types. Type A, that is a augmented. Type B, that is a bizarre reaction, chemical reaction, delayed reaction, end of the treatment, familiar reaction, genotoxicity, hypersensitivity, and unclassified reaction. These are the classification on the basis of Williamson and Brown. In type A, that is a augmented reaction, there is a cause of reaction which can be predicted and from the known as a pharmacology of a drug. In this adverse event, guys, there is a known pharmacological aspect, or this reaction is predictable. and this augmented type of reaction is present or it produced due to dose or a dose dependent, and it can be elevated by the dose reduction. For example, anticoagulant causes a bleeding, beta blocker causes a bradycardia, nitrate causes a headache, parazosin causes a postural hypotension, etc. Type B is a bizarre reaction. It is does not have a pharmacological effect, or it does not have a dose dependent. The bizarre reaction is are treated. It is very hardly, or it is a host dependent factor important in a predisposition. For example, penicillin causes anaphylaxis shock, then anticoagulant causes hypersensitivity. Type C is a chemical reaction or the chronic reaction. It is a biocharacteristic can be predicted from the chemical structure of a drug or metabolite, or it is chronic reaction caused due to excess amount of medication use or longer time period of medication use. For example, paracetamol causes hepatotoxicity. Type D is a delayed reaction. It occur after many year of a treatment or after prolonged treatment, so can be due to the accumulation of medicine in our body. For example, chemotherapy secondary tumor causes. Phenytoin during the pregnancy causes a teratogenic effect. Antipsychotic drug causes a tardive dyskinesia. Analgesic cause a nephropathy. Say then type E, that is the last one of the adverse event, end of the treatment of the reaction. So it can be occur or withdrawal, especially when the drug is a stop abruptly. So when we suddenly stop the administration of a drug or stop the drug by taking, this reaction occur. For example, phenytoin withdrawal causes a seizure, steroid withdrawal causes an anticortical insufficiency. This all about the types of adverse event. Thank you.